Beth Wytoski from the city of Dayton. We have Joyce Fleming, representative of Congresswoman Bonamici, and Al is on parental leave, so Joyce will be with us for a little while. We have Representative David Gomberg. We have Gioia's cat. Are there any other pets? Okay, not yet. We have Abisha Stone from Strategic Economic Development Corporation, and we have Brian Young, who's the Yamhill County Office of Emergency Management. And I think we also have Commissioner Starrett calling in, but she'll pop in a minute here. So I provided you all some thoughts and things to consider discussing, but I'd love to get started with the legislative update, and then we'll go to a federal update, Joyce, so you don't have to go first. But Representative Gomberg, what would you like to tell people in the community and e-board? All right, thank you for joining us again.
Indeed. Our emergency board met earlier this morning. In fact, I just got off the call about half an hour ago, and a number of items were there for consideration, including some extended support for small businesses, which I think some of the call participants will be very interested in. The other item deals with people who continue to wait for employment benefits. And I could talk at length about the problem, but I think you've heard it all before, that the Employment Division has been overwhelmed with the number of applicants, with changing rules, and with a computer system that's just ill-equipped to deal with both the volume and the changes. And the consequence is that too many people have been waiting too long for those benefit checks that they're entitled to, and are growing from angry to frustrated to despairing as they try to figure out how to pay their family bills. The step we took today is to say that if you're still waiting for those benefit checks, we can't give you money until we complete the application process. Those are federal rules. But we have some other dollars that are available for emergency purposes, and we are going to allocate some of that money, roughly $30 million, to say, for people who are waiting for their payments and haven't received them yet, they will qualify for an immediate $500 payment. I want to say that again. If you're in the line and haven't been processed yet, and we continue to wait, we're going to get you $500. The money was approved this morning. We need to figure out the process where you can make the application. I expect to have news on that by the end of the week. I think for people that have been waiting so long that this may be almost a little bit of too little too late, but it's a Band-Aid, and I'll take Band-Aids at this point and help people pay their bills with them. So a small step in a positive direction.
Well, great. Thank you. I mean, I think from everybody here, thank you, Representative Gomberg. That was the thing I most wanted to hear from you. So, and I just want to note that your newsletter this week is the most somber and frustrated, I think, that I've ever read from you. So you're letting your constituents know just how you're experiencing and feeling about it with all of us right now.
Well, thank you. You know, for people that don't get that news, because lottery tickets were not being sold, we were unable to issue lottery bonds this year. That's going to affect about 37 projects across the entire state. The news is heartbreaking when we have funds put aside to help with water projects and with dams, with cultural facilities, road projects, pedestrian bypasses, all those dollars committed, and suddenly we find out that we simply can't issue the bonds to pay for them, and we go back to square one. That was very, very disappointing news. And all I can say is that if we have to go back to square one, we're going to fight doubly hard to make sure those projects in our district get funded.
Yeah.
But I also need to make it very clear that projects not reliant on lottery dollars continue to be in the pipeline to be paid for, including the fire station in Sheridan, some emergency roads in Tillamook County, some schools in Lincoln County. Those dollars are still on track. So that's the encouraging news.
Yes, thank you. And I'm sure there are more questions from others on the call, but Representative Gomberg, you said that you thought there would be an application process. Doesn't this feels a little bit redundant for people who are waiting and waiting and waiting? But I'm grateful. So,
you know, that does seem redundant, Commissioner. You know, people are waiting for their applications to be processed. The short answer is that we're not going to rely on the employment division to disperse those payments. So instead of saying to the employment division, take your attention away from processing applications, we want you to handle these checks to 30,000 Oregonians or 80,000 Oregonians. So instead, we're going to have another process where they can get the money in another way, in an expedited fashion. I would prefer that we just simply mail checks out to everybody that's waiting, but that means relying on the employment division, reprocessing their coding on their computers, and taking them away from the tasks that they're already way behind on. So that's the explanation. But you're absolutely right. It does seem, again, a little bit insult to injury that you have to submit another application.
Yes. Okay. Thank you. Questions from the group? Gioia Goodrum has a question.
So how will you know that someone is in that pipeline?
You know, that's precisely the question that I've been asking. You may have read a situation where in Washington state that Nigerian hackers found their way into the unemployment compensation process and got away with millions of dollars of Washington's money. We need to make sure that there is some safeguards in place to make sure that A, we're giving the money to people who really are waiting, and B, they are real people. And so that's why I don't have an answer yet today. You know, understand that the legislature is not setting up this process. We're providing the funding to put it together, but I will be watching very carefully to guard against fraud and to make sure that the benefits are focused on the people that really need them.
Great. Thank you very much, Representative. Other questions? Mayor Wytoski has a question for you. And then Mayor Cooley.
So I'm curious for eligibility if this is like, I've had a couple residents who were denied their unemployment, even though they completely should be qualifying for it. Are they allowed to seek this money while they're trying to reapply for unemployment and figure out that whole mess?
My guarded answer to you is yes, but I'm not absolutely certain.
Okay.
Great, thank you. And then Mayor Cooley.
So I have kind of an unrelated question to that, and maybe someone else can chime in on this too.
Well, Mayor, since I represent you, you can ask me anything you like.
And I'm going to. So I have a little concern with the way that OHA is reporting the actual and presumptive cases. So I would rather see that. It would be more helpful for me, I guess, if I knew what was what. So how many are actual cases and how many are presumptive cases? Because I have no idea of 400 cases that 350 of them aren't, I think they have it. So I would like to see OHA change the way they report that and report those as two separate items.
You know, I appreciate your question very much, and I agree that that the information could be more clear. I will also add that there's limitations in the information that can be distributed in order to protect privacy rights, whether it's identifying families or identifying communities. I've had some people write to me and say, why can't you at least tell me that the outbreak was in Sheridan, or whether it was in Newburgh, or whether it was in McMinnville, instead of just saying that we have an outbreak in Yamhill County? And the answer is, well, if we tell them the outbreak's in Sheridan, who's going to go shopping in Sheridan? And what makes you think that you're any safer in another one of our communities? So that's been an aspect of it. You know, I will tell you that there is testing going on in Newport right now, which is unique because instead of testing people who have symptoms, they're going door to door doing testing. And as a consequence of that, we're coming back with a much higher positive rate in Lincoln County, 3.4%. You know, 3 people out of every 100 are showing positive symptoms. Let me rephrase that. They're coming back with positive tests, even though they're not showing any symptoms. And that's problematic because it says there's so many people walking around that have tested positive that may be contagious. As I said on the phone last week, we're continuing to learn about this process. And I think the door-to-door testing that's going on in our district is helping us learn a little bit more about what's going on and whether asymptomatic people are a threat to their neighbors and their families. You're on mute, Mayor. I see your lips moving, but you're still muted.
Mayor Cooley, you're still muted for now. And I do want to add that when you
No, I got it.
perfect. If you look at Mayor Cooley, if you look at the OHA, the main COVID page where it has the lists of the numbers, one of them is positive and presumptive cases, and that's kind of your top line. If you go one or two more down, you'll see the number of positive tests. And I apologize. I do the subtraction, and so the difference between them is the current presumptive cases.
Right, and my concern is that notification that I get every day from OHA doesn't do that. So unless you dig further, you don't know. So the numbers could be way different for actual cases than what we think they are. So I think that OHA ought to be recording those as two separate things on that email they send out every day.
Okay, I understand what you mean. Yeah, and thank you, Representative Gomberg, for explaining a little bit more.
Thank you.
Are there other questions for Representative Gomberg? All right. Oh.
Right, I will close by telling, and I'm going to have to run in a minute because I got another meeting coming, one at 1:30 and one at 2 o'clock. But tonight I am going to be doing Senator Roblin's radio show, which is being simulcast over Facebook. And the topic that we are focusing on is small business. The State Treasurer, Tobias Reed, will be on. I will be on with representatives of the Oregon statewide chambers of commerce, and we'll be talking about the small business impacts, particularly in our part of Oregon. So I hope particularly if you're involved in the chamber movement or small business that you'll tune into that.
Great, thank you. And Gioia, Gioia, is the time again?
I think it's at 5 o'clock.
5 o'clock. And how do I find that on Facebook? On Senator Roblin's Facebook page?
I believe that's correct. Facebook is like, how do you give me directions on how to get to the third stop on Mars? I don't get this stuff. I just turn on the computer and talk, and somebody else figures out how to get it around everybody else.
All right, thank you. I'll figure it out. Thank you so much. I appreciate it.
Send me an email. I'll get you an answer.
I'm sure it's a KXVR, I think, out of Florence, the fireside chat. So I'm sure stringing all those together, you'll get there in a search engine too. Okay, great, thank you. And I just want to welcome, observe that Commissioner Olson and Commissioner Starrett are with us too, Yamhill County Commissioners, joining just a little bit past my 1 o'clock start time, because I started at 1. Okay, thank you very much and welcome. What I'd love to do now is—
That's why we're late, Casey. You always start at 10 after 1.
Hopefully not 10 after 1 all the time, just sometimes. But I'd love to have Joyce Fleming from Congresswoman Bonamici's office do a brief introduction of her, and then let us know and let the community know what the federal delegation is working on. So Joyce Fleming, welcome.
Hi, thank you. Thank you for letting me join you. I think most of you know Al and their wife had their baby this weekend, so a healthy baby boy. And so I found out this morning that I will be joining you for this meeting for the next couple of months. As far as what the delegation is working on, I can certainly try to provide a more thorough update next week when I have a little more time to get that information. I noticed, Casey, on your talking points or your thought points, one was the expiration of expanded unemployment benefits. I know that that is something of particular concern, and looked like probably most of you saw it. There is some positive news. We're hopeful that will continue into next week. The House is going back next week. I'm not quite exactly sure when the Senate is going back, but I know there's a lot of work to be done, and that is certainly one of them. So thank you.
Great, thank you very much.
And an introduction to myself. I've been working for the Congresswoman for 8 years, and I've worked with some of you, but look forward to getting a better grasp on what is happening in Yamhill County. So thank you.
Great, thank you very much. Are there questions for Joyce, just to put her on the spot, or because you want to know things? Okay, great. Thank you very much, Joyce, and welcome. Thanks. Yes. I'd love to move now to commissioners. And Commissioner Mary Starrett, what would you like to tell people in the community today and here on the call?
Thank you, Commissioner. Can you hear me?
Yes.
Hello?
Yes, we can hear you.
Okay, we can hear you, Mary.
Okay, there's Commissioner Olson chiming in. I can't see you, but I can hear you. Anyhow, thanks everybody. Just a couple of things. I wanted to just call to your attention a couple of issues that have come to my attention, and that is several people have gotten in touch with me saying that they had tested negative, but were being considered, or they had been coded as a positive, wanted to know what to do about it. The other one was one that came to my attention tragically. A young person under 30 in our community passed away this weekend, and this is a person who tested negative. This person was considered and coded as a presumptive COVID case. They asked for an autopsy and have been refused an autopsy, at which point they opted for an independent autopsy. And so what I'm trying to do is work with our public health director and our HHS director, Dr. Manfred, to talk about, number one, how does that work where the medical examiner doesn't show up at the scene and then the deputy makes a call that it's not a crime scene. I mean, they have no idea why this person died. They'd gone to a local hospital who sent them home and said, if you have problems in the future, call 911. So there's a lot about how these cases are being, in other words, what's a positive, what's a negative, what is the procedure for presuming a COVID when there's a negative test. A couple of things like that. I've also found it interesting to look at some of the actual deaths throughout the last few years by month and by year, and you don't see that we are off at all, really, for the most part. If you go deaths by month of death and county of residence and look at the total number for a year or the total number for a month, we're pretty much on par. So I am a little concerned with the fact that we are coding people as, or calling them a positive case for two reasons. Yeah, there's a lot of testing going on and a lot of people who are asymptomatic and a lot of people who are testing positive. But also I think the bottom line is the number that is most important, and that is hospitalizations. We continue to have about one on average in our county. So we might look at the number of positives and be alarmed, but I think that hospitalization number, which was the rationale for shutting down the economy, and also looking at the historic numbers, years and months for overall deaths by county numbers, really is instructive when we see that they really haven't changed for the last few years. So I just wanted to say those are two things that came to my attention, and I don't really have any answers, but I know that Dr. Manfred has been really good at trying to work through this so that we can come up with sort of how do we wrap this up and what do we call it at the end of the day for the family that is really kind of confused. So that's my input right now. Thank you.
Okay, thank you, Commissioner, for sharing some very somber thoughts. Do we have any questions for Commissioner Starrett?
Yeah, I have questions, Commissioner.
Okay,
thank you
please.
So much for your thoughtful research that you put into your update today. I have questions about comparing deaths by year over year, just because we haven't seen anything like a pandemic. that's hit our society. And so I wonder if our community death rate is staying the same, if maybe there's some sort of a statistical adjustment that we might consider, like fewer people are driving on the roads, so we would have fewer car accidents, fewer people are doing extreme recreation. I can't imagine that there wouldn't be other adjustments we would make to that number in light, again, of never having experienced something like this. And the concern I have is that we could lose the seriousness of people actually dying from this virus by doing a year-over-year comparison. So were there any adjustments that we made to those statistics when we pulled them for comparison?
Well, what I did by looking at the statistics, which actually came from Senator Boquist, was to really just, again, when we look at the number of deaths, yeah, definitely you've got, but also we also have people who have been brought in for motor vehicle accidents, and we know that that was the reason for their demise, and they were tested and tested positive for COVID. They're listed as a COVID death. So we have to be really careful how these statistics are being generated. But I also know that it is important for us to, again, look at that one number, which is hospitalizations. And typically people are being hospitalized prior to dying, and except in very rare cases. So I think the hospitalization number really does tell the story.
Thank you for clarifying. Even without a net gain in deaths for this time over 2019, I still don't want to lose the seriousness and the importance of coming together as communities to make sure that we're preventing as many deaths, which of course is the culmination after a hospitalization, after a positive test, after a presumptive case. So I really see the death toll itself being the climax of concern. And I think that's a good reminder that even as we balance economic adjustments, even as we balance uncomfortable community conversations, the mortality rate at the end of this is what we're trying to bring down. We want to keep the quality of life high for all members of our community when possible. So thank you. I appreciate your statistics.
Do we have other questions for Commissioner Starrett today? Okay, thank you very much. I did note that last week about this time, I looked at the death data that the Oregon Health Authority has, but I only was looking at it statewide, and they have a little informational figure with it. And they, at least at the time, were saying that seasonally we are higher statewide. I don't know about the county, but but statewide, that's what the data shows. And I will also find out how definitions around coronavirus deaths are being dealt with, because I have had questions about it, and I have had answers. So it's always good to follow up with that again. And I believe there was one more question for Commissioner Starrett. I thought I saw in a chat. Oh, sorry, excuse me. Abisha actually would like to go back to Representative Gomberg before he leaves, if you have a moment for another question. Yeah, okay, great. Abisha.
Thank you, Commissioner Kula, and I apologize for going backward here, Representative Gomberg. I was distracted with another issue. I did have a question for you that was raised by one of our industry partners. This question's come up a few times previously, but it's specifically in regards to the funds that the state is using to purchase PPE. And the question is whether or not there are requirements on those funds for a buy local program. So really the question is, the funds that the state is expending to buy PPE, are they buying product made in our state? Or do you know if those funds have that requirement attached to it?
I'm making myself a note because I don't know. So let me see if I can get an answer to that question and get it distributed to all of you.
Thank you. That would be really helpful. We have a few, as you know, large manufacturers, and one of the the largest apparel manufacturers in the state is in our region and is not having a lot of success in working with the state and would really like to. And that's where that conversation comes from, is are those funds even being used to buy local? And if they are, wonderful. Maybe they're just not the right partner. So thank you, Representative. I'd appreciate that follow-up.
All right, I will. Thank you.
Great, thank you very much to both of you. Commissioner Olson, what would you like to tell people in the community today and here on the call? And welcome.
Thanks, Casey. Didn't know if I was going to be able to get back from Salem, but I made it. I'm hearing the same thing that both Mayor Cooley said and what Commissioner Starrett said. I probably spent half my time this last weekend explaining to people what presumptive is and what actual is. There still seems to be a lot of confusion among the citizens that does, they think, well, presumptive, we've had 342 or 171 new cases of COVID. Well, we haven't had that. And that's why back in March and early April, when we first started getting reports from OHA, the initial reports did separate out actual from presumptive. And then I'm not so sure if it was towards the end of April or into May where they were combined back together into one category. And I've also heard the same thing that Commissioner Starrett said, that people have passed away and have been tested after they passed away and they've had the COVID virus, but the passing away might have been a motor vehicle accident, might have been some other cause, but it had nothing to do with related to their COVID, but they were classed as a COVID death. So that's a little bit of my concern. And I think because when you look at the total overall numbers, presumptive and actual, it's a huge number, and I think it's a big problem. But I think we have to do something better to have people understand what the difference is between presumptive and actual. Because I'm saying with Commissioner Starrett, I look at the hospital rate and look at the other rates, because the numbers to me, not knowing what is presumptive and what is actual until they run all the tests, doesn't mean a lot to me, because I really don't know how many cases there are. So, but I think that's the only thing I have. I know I did go to Newburgh and McMinnville this weekend. I'm very impressed. It seems like the economy is opening back up. We're seeing much more traffic on the roads nowadays. Everybody loves the idea of downtown McMinnville being closed off from 4 o'clock Friday to 4 o'clock Sunday for dining out. And I was really surprised. Almost every restaurant is participating. And Gioia probably knows more of this than I do. But I think it's a good idea. And I hope they can, even when COVID's over, I hope they can extend that. And so that's about all I have. I'll take any questions you have, Casey.
Yeah, do you have questions? One thing that I just want to note is that in the Yamhill County HHS coronavirus page, it does list both the number of positive diagnostically confirmed cases and the number of presumptive. And right now we've been holding steady for a couple of weeks at 3 presumptive cases, and I think we're at 218. 208 for confirmed cases. So it is a pretty small number, but it's, just so people know the where we're seeing our numbers.
And that's why, Casey, I think I pay much more confidence for Yamhill County in Lindsay Manfred's report, because it does separate all that out, and we also get it by zip. We also get it by zip codes. So, I think that's more information. Mayor Cooley and talked earlier about, and so did Representative Gomberg, about how many's in Sheridan, how many's in Newburgh. And the county's report actually separates that out for every city in Yamhill, or every zip code in Yamhill County. And that's really interesting. But I can tell you what, other than the baseball team, one in Newburgh, if you look at it, basically the county's pretty well equaled up based on population.
Okay, thank you. And I do know that at least the city of Dayton has been, because of its size relative to the number of people who have been infected and tested positive, also I believe is currently the highest zip code on a per capita basis, even above Newburgh right now. Yeah, but I believe that there was a question from Abisha.
Yes, thank you, Commissioner Kula. This question is actually for all three commissioners. So let me start by saying that I really appreciate that you host these webinars or conferences, that you participate in these panels and you're listening to what our community has to say and what we're concerned about, what the business community has to say and is concerned about. And at the same time, I'm also reading and hearing about concern related to finances for individual jurisdictions, important projects that have now been put on hold or canceled, as Representative Gomberg was sharing. And I am curious from the county's perspective what your concerns are, either currently or forward looking, in terms of budgetary shortfalls for lack of revenue from businesses or other resources or projects that have been put on hold or canceled. My perspective is working at a regional level to try to support the development of economic capacity, and certainly your concerns matter in regards to how we continue to do that effectively. So I'm concerned from your perspective, from a county perspective, what are the issues that keep you up at night at a county level?
Commissioners? Well, Commissioner Olson is unmuted, so.
I'll go ahead and answer that, Abisha. From my standpoint, what really concerns me is the trickle-down effect, is that so much of our HHS funding, criminal justice funding, and everything comes from the state or passed from the federal government down through the state. And if we don't see better revenue projections, I don't know how we can maintain all of our mental health programs, our law enforcement programs, our criminal justice programs, because not a big percentage it comes out of the general fund. And if you ask me, I think that would be the biggest issue. My second one is if we would have to take a step back, I think our economy would be dead. I think the money we get from the video lottery is just starting to pick up now. It would start going back down, and I'm really concerned about people going back to work.
All right, and Commissioner Starrett, what do you think?
Well, I think that Commissioner Olson is spot on. A lot of the revenue, if you look at the pie chart of the county's budget, so much of the programs that we've instituted, for instance, at Health and Human Services, which have put us on the map in terms of some of the work we have with the nonprofits and all that. That's grant money that we get that we're able to do a lot of work through Provoking Hope, through a number of other Lutheran community services. And a lot of those programs couldn't be sustained without funding that we get from the state. So we know that there are going to be cuts coming from the state level. The other thing is we don't know what we're looking at as far as lack of property tax revenue. We know that only 13%, 15% of somebody's property tax check goes to the county, but that really is a significant portion of our general fund money. And so we don't know what that's going to look like, and we don't know what the impact on the loss of businesses. We know we've already lost some businesses in our community. So really, at the end of the day, nobody has any idea. We're starting to try to make some estimates, but we can't make those estimates because federal and state dollars do prop up a lot of what we do.
Thank you.
So I have a question to follow up then. How are you prioritizing essential services? We can't simply lose mental health. We can't simply lose infrastructure support. We can't simply cut our state corrections facility or our judicial system. We have to invest in those organizations, in that critical infrastructure. So how are you reprioritizing so that we are able to maintain stability? Because we know the budget cuts will continue. Even though we're seeing an uptick in Oregon Lottery funds, we're also seeing that the Oregon Lottery is now announcing this week that they're cutting funding to several programs. So what is your process? And I understand if you can't answer this now in a panel, if it needs to be a conversation that you have officially on the record, but what is your process to prioritize those critical infrastructure components so that as you lose funding, we don't lose access to those services for our county?
Well, you're going to lose access to some of the services that we have. For instance, you talk about mental health, but what does mental health mean? We know we've had some significant cuts in terms of behavioral health, which came prior to COVID, any of the COVID situation. So we've got that concern. But what we need to remember is that you can't just say mental health and then leave it in, in one basket, because we have a number of programs. But again, as we talk about, if the money is not forthcoming from the state for the programs that we have stood up, we only have a certain number of dollars, and based on that, we do have to go with the basic core functions of government, which have to do with public safety and have to do with public health. Those are mandates from the state. We typically do get what we need for funding for public health, but at the end of the day, there are going to be significant changes if we have shortfalls in revenue, and we can't do what we can't do. But I do have to say that for the most part, we've been able to really do I think a really good job of prioritizing in the lean years when we have had some of these types of shortfalls in the past.
Thank you for the clarity. I would still argue, especially, we've said this before in recent weeks, we expected this situation of both the pandemic and the economic downturn to be temporary. And as we enter into a long-term season of dealing with this, things like mental health will not be expendable. And if you look at what it will take to addressing costs for not appropriately responding to the mental health of our community, is going to affect our employment rates, our recidivism. It's going to impact our positive educational experiences. So I would ask, you can look at it in the quality of life, or you can look at it on an economic standpoint. Economically, it's in our best interest to continue prioritizing certain aspects, to recognize that mental health services are actually a good financial investment for our community, as well as a solid priority for us as well.
Well, I think that's a really good argument for us to make sure that the economy stays solid, and any further shutdowns have impacted our drug overdoses, alcohol use, drug use. The mental health components of the shutdown have been significant.
And Commissioner Starrett, can you explain for the general public how the costs and the provision of services happens with the county around mental health and behavioral health in general? Because I think sometimes people don't know in the general public how it works.
Well, it's basically just sort of a pass-through, if you will, and we go through this during our budget committee meetings, where we basically look at what comes in and what the restrictions are around it. So if we get money that is supposed to, for instance, let's say we get money that's supposed to prop up a residential treatment facility, we can't use that money for counseling in the schools. If we get money from the state or the federal government that would support a school-based health clinic, it has to be used specifically for that. So when you pull back those, or when we have those sort of rugs pulled out from under us, we don't really have a lot of options, and we have to go to general fund. And only a small percentage of Health and Human Service money comes from the general fund. Some counties don't give any general fund. They simply rely on the money that comes from the state or the federal government. So I have to give props to the county for really taking that money and spreading it in a number of different areas. But so it really is a pass-through. And what they say you can use it for, you have to use it for, and you don't get a lot of wiggle room.
Sometimes I forget to unmute still after all of these months. Thank you, Commissioner Starrett. I just want to note too that since we're the contracted behavioral health provider for the Oregon Health Plan for this region, this area that mostly includes Yamhill County, we do provide services and we have billable hours for that. So we are essentially, the county is a provider of health services the way that Physicians Medical Center provides health services and then gets reimbursed or gets billed by to OHP. So I think that makes our county different than other counties in terms of the provision of behavioral health services. Okay, welcome Mayor Cabe. Commissioner Olson, did you want to add anything?
Yeah, just we hadn't touched on this yet, Casey, but I'd like that. Mary talked very well about HHS and public health. We have the same kind of issue in criminal justice. We used to make pretty good out of our general fund. We used to make pretty good money in bedroom, and that's renting both adult beds in our jail and juvenile beds to other counties who didn't have the facilities, were packed. That was a big part of our general fund for law enforcement and criminal justice. And now that we've lost almost all of our bed revenue, we don't see that coming in anymore, and we don't see the number of juvenile beds that we used to see filled. And so that's another revenue stream that people don't think a lot about. When we provide services for other counties, we get revenue for that services. And if they don't send anybody our way, or if they let everybody cite everybody and let them out of jail, or just let them, we don't get any of that money. So.
Yes. Okay. Thank you. That's a good clarification. And I didn't put in my 2 cents, Abisha, but from my perspective, based upon what I see in the numbers and what I'm listening to when I talk to our budget officer, I don't actually think that we're going to see cuts in services in the county, at least in this next fiscal year. I know, right? All right, I would love to make sure that we're still moving around the circle, around the table here. And before we go to mayors, can I get the economic development and business folks on? Is that good, mayors? Are you okay? All right, I got one. All right, thank you very much. Gioia, Goodrum, what would you like to tell people here on the call today and in the community?
Thank you. Thanks. Hi, everybody. Thanks for letting me be here. A couple of things. Of course, I keep talking about Lemonade Day. August 15th, we gave out 35 warm bags this past week. Folks that still need to get a Lemonade Day bag, they are at the Children's Library here in McMinnville, and they're also going to be delivering some via the Bookmobile. So we're really excited about our partnership with the library and truly appreciate their helping us get this stuff out to the kids, because that's really the most important thing. So hopefully kids will participate and they could do Lemonade Day their way. There's a whole website that explains that to them. If anyone has any questions about that, please call the chamber 503-472-6196. The other thing is tomorrow we're having a webinar. We're doing 2 more webinars. One is tomorrow, Innovating and Pivoting During a Crisis. We've got 2 of our chamber members talking about how to just think differently during this pandemic and how they've taken their businesses and shifted their focus to create something completely different. So that'll be very interesting. We had one last week and that was quite successful. And then next week, Holly is going to be talking about how to use a chamber website to grow your business. And tomorrow also, Oregon State Chamber is having a conversation from 10 to 11 with Boley Director Val Hoyle, the Labor Commissioner, and Michael Wood, who's the OSHA Director. I guess his title is Administrator. And that's from 10 to 11. If anyone has any questions and want to attend that, just let me know. They can email me at president@mcminnville.org. And that's all I have for today. Thank you.
Great, thank you very much. And Shannon Buckmaster requested going last of the 3. So Abisha Stone, what else would you like to tell people? And note that she put some information in the chat.
Thank you, Commissioner. Oftentimes I'm trying to put information in the chat as I'm speaking, and it doesn't always work very well. So there are a few things that I added in the chat. First of all, SENCOR's PPE manufacturer panel webinar was hosted last week, and I'm realizing that Wednesday at noon is a very popular time for these sorts of events, and I know that several of you who wanted to attend couldn't, so I posted in the chat our YouTube live link. And so for those that can't see the chat, if you want to search SENCOR on YouTube, you would have access to that, and you'll have 4 of our regional manufacturers talking about what it was like to experience running a manufacturing facility amidst COVID and to transition midstream to be able to make PPE to serve our community's needs first and foremost, to keep their folks employed, and to continue moving forward with their business, frankly, to try to strengthen and stand up their business. From our region, we had ADEC was represented, who is a Newburgh business, of course, St. Cusair, who's also a Newburgh business, and we had Northwest Alpine, which is a business that originated in Newburgh and is now in Marion County, but still considers himself to be a Yamhill County guy. So I just wanted to share with you, we also had a Watershed was represented on that, so you'll find the link there. Secondly, I wanted to make sure folks are aware of the fact that our regional effort to secure funds for another small business COVID relief package was successful, and we are now launching a business grant program that Willamette Workforce Partnership is administering. So you'll see in the chat, there's information in regards to that. The application window is July 21st through 23rd. Application and process can be found in English and Spanish at Willamette Workforce Partnership's website, which is willwp.org. And I want to give yet another shout out to Yamhill County commissioners for being so proactive early on and issuing funds for a countywide program that supported our businesses, which has allowed us to leverage those funds as we continue to ask state partners and some of our foundation partners for funding to support continued efforts. And had it not been for that early on work that Yamhill and Marion counties engaged in, we would not have those funds to leverage in these asks. So thank you for doing that. I don't want to steal Brian Young's thunder. He might have some thunder to share, but I do want to let folks know that we have some, we have some masks that were issued by the state to support our business partners that are in need. And Brian and his team are distributing those masks. So if those who are looking for access to masks, maybe small business owners, Main Street restaurants, things like that, please reach out, of course, to Gioia, Shannon, other chamber, downtown association groups, and or emergency management for Yamhill County directly to see if you can get access to those. I also wanted to mention, I'm hearing people talk about employment and jobs. We have quite a few manufacturing partners throughout the 3-county region who are saying that they are looking to hire and having a hard time finding employees. This is not an uncommon conversation. However, the barriers to employment for some folks right now are different than we've ever seen before. And I just want to put it out there that we are in this strange position where we still, of course, have a very high unemployment rate, and companies with good, solid jobs that are well paying, that have benefits, who are looking for employees and can't find them. And so there's something there. There's a there, a fix there, something that I think we could all be working on to try to bridge a gap. And I just wanted to put it out there that I'm open to all of the conversations with any and all of you about how we might be able to support helping some folks find some good jobs. And I think that's it for me. Thank you.
Great, thank you very much. While I was listening, I was also looking, if you go onto the OHA COVID main page and you scroll down to additional data and projections, there's a whole host of, I forget what they're called, dashboards associated with death data. And the main one that you click on, when you click on it, it notes that Oregon is experiencing right now both above the 3-year average and above the 5-year rolling average seasonally for deaths from all causes. So I just want to put out there that that's according to the Oregon Health Authority, is that we're above the average for all causes. And I'll try to put that into the chat feature, the link to that information. Okay, Shannon Buckmaster, what would you like to tell people today?
Thank you. I asked to go behind us, Abisha, especially because a lot of the things that we're excited about were programs that SENCOR is supporting, and I figured Abisha could explain it better than I would. And so thank you for those updates. The only thing I would add to that is that, first of all, we do have masks and now face shields available from Brian Young. Thank you so much. We just picked up 2,000 more yesterday morning, 100 face shields. So we're set and ready to go for our businesses. Call our office or email office@chehalem.org or call our office 503-538-2014. We are tracking our businesses so that we know where this incredible resource is going in our communities. I think that's just a great level of transparency and accountability that we can provide both our public partners and our private business partners as well. And then we're also still thinking about what this looks like to transition as a pillar of the business community for the fall. And we have decided that we will continue approaching beginning with and maintaining a virtual model as needed for our Leadership Chehalem Valley process. We have a 2-year program, so your first year, you're a participant, your second year, you're part of the steering committee, you plan it for the incoming years. So we have a cycle of leadership that we promote within the program, and enrollment is open for that. And we're excited to be able to provide another avenue of not just connection, but professional development. And when I go through our graduating cohort of the last several years, I see brand new city councilors. I see people who are working in different capacity. I see 2 people who have gone back for a master's degree associated with administration or public service directly as a result of this program. And I can't think of a better time to invite anybody who's frustrated, discouraged, empowered, excited, creative, frustrated, just if you have the energy, put it to good use for our communities, because we're looking for that next generation of leadership. We're looking for the new type of leader who's willing to help us find solutions to maybe situations that we haven't been able to solve yet. So those are my updates.
Great, thank you very much. And then unless there are questions for Shannon, I'd love to follow up by segueing into Brian Young, our emergency management manager, our emergency manager. Brian Young, welcome, and what would you like to tell people today?
Hi, can you hear me okay?
Loud and clear.
All right, perfect. Figured that one out. I guess first off, since Mayor Cape is on now, would you like to go, since we're getting towards the end of the time, do you have anything you'd like to add? I'll relinquish my time if needed.
Wait, not Wytoski?
Oh, I guess Mayor Wytoski's here too, so.
Well, Brian, thank you for joining us. Again, if you have anything, just go for it, but
okay.
we'll definitely move on to mayors then.
Okay, I apologize. Real quick, yes, like Shannon mentioned, we do have the masks going out. We're down to, I want to say, just over 1,000 in stock out for the businesses. So thank you for the chambers and associations for being those partners out in the field. I got word the other day from Oregon Emergency Management. There's no word on continuing that program yet. I don't want folks to get down because it's still a maybe. We're just waiting for that to happen, and we would love to channel those through our offices and get those out to the businesses. And hopefully, if they release some of those masks in a larger number, we'll be able to provide to the businesses for patron use also. Right now, it's specifically for employees to help out those employers. So I apologize for any miscommunications early on for that. But yeah, SENCOR has been great. Abisha, thank you so much. I think that's all I have, unless anybody has anything specific for emergency management.
Questions for our emergency manager? All right, great. We will ideally have you on over the next couple of weeks, and we can keep pushing the questions. But thank you so much for working with all the leaders here.
Yeah, thank you. And Commissioner, can I have one more thing real quick? We will be out from Wednesday to tomorrow to Friday. So I'll have my stuff with me, but the wife and I are going to take a well-deserved trip down to the Redwoods. Have never seen them before, so want to see some giant trees. And we're going to slow roll up the coast and take our time and just relax.
Great, thank you. I'm glad to hear that. And I echo Abisha. Your team at Emergency Management has been so great. So thank you for some specific help. Mayors, let us start with Mayor Cooley. What would you like to tell people in the community today?
Well, I want to apologize first for not being on for a while. I had some issues going on in my own life that took precedence. So, and just like to encourage everybody to keep up with what's going on and follow the rules and stay safe.
Great, thank you very much, Mayor. Mayor Wytoski, what would you like to tell people today? Besides, hi, Annalise.
Sorry, I knew you were about to call on me, and so did she. So she tripped and fell and just skidded across our wood floor. But she seems okay now. One thing I want to talk about a little bit is the new mandates that we just saw issued, wearing masks, particularly for outdoor. I got a lot of questions and comments about that really quickly. So one thing I want to make sure that is clear is it's when social distancing cannot be maintained. So a lot of the questions from my community were, if I'm going for a walk around the block, I really don't want to wear a mask. When I'm out exercising, I really don't want to wear a mask. And so my clarification for them has been, if you are staying distant from people, the mandate does not apply to that. So I just wanted to make sure that, that we're all on the same page here regarding the outdoor use of masks. And the other thing is, for the other big part of the new direction, is that that 10-person limitation. I know that there were a lot of concerns. I got questions right away, from school officials who are hiring, for example, and they have hiring panels and interviewing folks and trying to figure out how to accommodate it. But it's workplaces are exempt. Places of worship are exempt. Really, what we're talking about is limiting our social gatherings that are really purely social. And again, that comes down to the result of contact tracing. Lots of our community spread has been traced to social events, house parties and retirement parties and graduation parties and bachelor and bachelorette parties and birthday parties and all those things that we really love and miss. And so I do want to make sure that we have a really good understanding of what that really applies to, because I think that there were some immediate concerns with, oh my gosh, nobody's allowed to get together for any reason. We're in masks all the time, and of course, neither of those things are quite true. So I just wanted to make sure that I clarified that. I'd also want to talk a little bit about, there are a lot of questions that are coming up that are not answerable just yet, but about schools reopening, about how sick time for teachers is going to work. I'm sure Mayor Cape can attest to the long list of subs I'm sure they have for bus drivers. And I would guess that it looks a little like the sub lists for other educationally related positions. And there's going to be a lot to reopening schools, and at least half jokingly, part of me, in hearing from folks that the economy cannot be recovered until schools are open, that parents cannot return to work until schools are open, that employers cannot function correctly, that the schools are the backbone of all. Like, is now the time that we can talk about school funding then? Because that seems like now might be a good time to have that discussion when we see what a critical role schools play, both in preparing our kids to be future contributors and participants in the economy, and also the fact that we're providing the only affordable childcare option available for an awful lot of working families, which is allowing our economy to exist. So I say that half jokingly, but I really hope that culturally we have a little bit of appreciation for what's happening in schools. And again, to further that, Commissioner Starrett commented on some of the mental health aspect of this, and I know we've seen increases in things like child abuse, attempted suicide, drug use and things, particularly among youth. And, again, just to point it out, and Mayor Cape can speak to this too, I'm sure. But, we don't just educate kids, we feed them and we clothe them and we counsel them and we get them resources and we try very hard to keep them safe, and we give them lots of skills outside of their academic points. So I really, really hope that we step back from this with a little better appreciation for what our schools do in our communities.
Thank you, Mayor Wytoski. I mean, I did say backbone of the community and the economy last week, so it does make me laugh. And I do think that along those lines, I hadn't realized how much people craved and loved the parks of Yamhill County and the city parks and the regional parks until they were closed, and we couldn't figure out how to safely and easily reopen them with the staff we had. And some of you are laughing, and really that was an eye-opener and an important thing for me to understand. Do we have any, since Mayor Wytoski brought up a lot of things, are there any comments before we move on to Mayor Cape? Okay, great. Thank you very much, Mayor. Mayor Cape, you want to lead us home?
Sure. I was laughing because a handful of years ago, I can't remember exactly how long ago, we had some trees in our city park that were deemed dangerous. They had a disease, and we had branches falling, and we were afraid that the trees themselves would fall over, and it wouldn't take much for that to happen. And so we cut down, gosh, I want to say it was about 10 or 15 trees. And oh my goodness, the uproar from the public for cutting down dangerous trees to try and keep the park safe. And now, yes, I can believe the uproar because of that, yes, people do take their parks and everything associated with the park extremely seriously. So that's what I was chuckling about, just the wonderful memory of people getting upset because we needed to remove some trees. And I also wanted to mention happy anniversary to Mayor Wytoski, and the anniversary parties is probably another one of those to add to the list with the graduation.
We didn't have a party.
No, but those are the things that come up that get people to get together, and I understand that's where that's coming from. And just today I got some more text messages from friends also saying, well, how is this going to affect schools and whatnot, and yeah, it's kind of, I think it's sad also that we have to, it's really limiting those personal interactions, those personal parties, and limiting it to 10 people, right? That's what the mandate is for. And it's really kind of sad that we have to get to that point in this process. And people have asked me, well, what's this going to mean for schools for next year and all that? And really nothing that came out from these mandates, these most recent mandates, is going to affect schools, right? That's all stuff that's going to come out later. And I always tell people when they ask me about that too, I'm like, well, this is now. Let's see what next week brings, because I'm sure there's going to be something different next week, so let's focus on what we have to work with today, and we'll focus on next week when next week comes. And one thing I do know is, our reentry plan is basically done. It's going out to the public, I believe, later this week. And obviously there will be some more tweaks to it, but by and large, the plan itself is done. The thing that we're really focusing now is the work instructions and how do we implement that plan. And that's really the nuts and bolts of it, the basics of what's in the plan, which is what we've all been waiting for, is really pretty vanilla. There's not a lot in the plan itself. It's the work instructions and how do we implement that plan. And that's where I'm going to be really swamped with the next couple of weeks. Just in transportation in Salem-Keizer, we have 7 different work groups to address the reentry work instructions, and I'm in charge of 2 of those myself. So, we're going to be really swamped, and that's why I was late joining today, is because I was at work with one of those groups developing those work instructions. So, and the bottom line is, people keep asking me, well, is school going to open next year? Are we going to have school next fall? And the bottom line is right now, who knows? We don't know. What I do know is we're going forward with the assumption that there is. And so we need to get those plans developed and ready for hopefully having in-person class, right? And but just like I can expect different instructions more than likely next week from the governor, there's going to be different instructions for what education is going to look like between now and September. I think it was just yesterday, San Diego and Los Angeles County schools announced that they were not going to have in-person classes this fall. And obviously those school districts have nothing to do with Oregon, other than they're 2 very large school districts that sometimes lead the way for the entire country. And so we need to be aware of what they're doing, but that's not going to have an impact directly on what we're doing. But it's also worth noting because it is a big development in the education world. And so I don't know what it's going to mean. All I know is we're going to prepare with the best information that we have right now and hope for having school, and hope that, as Mayor Wytoski has alluded to, that we have the funding for what we have to plan for, because that's the other part of it. We can make a plan and we can make work instructions, but if you don't have the money to make those things happen, it doesn't really matter what you put on paper. And so, there's going to be a lot of changes between now and September. And it's just a matter of, we got to work through and hope we come up with a great plan that will work for everybody. And there will be changes. That's all I got. Nothing too. Yep.
Thank you, Mayor. And I'd just like to note that for Joyce Fleming, that there's 2 mayors who are also 2 school employees who would like more money. Just putting that out there. Yeah. All right, great, thank you. And as far as I understand, there's at least a draft bill in the Senate, at the Senate level, that has money specifically for schools, but I think it's like this amount of money compared to the need. So something to consider. Are there any last thoughts here on the call today?
Well, I was gonna give Brian a little send off for his view to the redwoods, but I think he's not on video. But this is the redwood that's in my front yard. That's about 60 years old that I get to enjoy every day.
That's awesome. Yeah, we've got one in our front yard, but you can't see it here. But yeah, I've never seen a tree that was 300 feet tall and 2,000 years old. So I'm going to be in heaven, I think.
We'll have fun.
We'll have a great trip.
Yes. And I do like to note too that while we're observing people's environments, that Shannon, Buckmaster, when you unmute yourself and a big truck goes by, my headphones vibrate with the truck sounds, and it's really groovy actually to be like, woo. So I just want you to know that I really appreciate it.
It's one of the few drawbacks to being back downtown Newburgh, but I wouldn't trade the view or the traffic outside my window for another situation. We're serving our community well here. Thank you, though. That's interesting to note. You've commented before on my wind chimes in my backyard at home being a little loud, and now we've got traffic. I guess you get my comments with a cost.
That sounds great. I'm honored to have those comments with a cost. And actually, I can't really hear anything because of my tractor days, so that makes me a real farmer because I'm slightly deaf.
Commissioner, can we see what that sound does to you again? That was, I think I missed most of that.
No. Okay, well, to wrap up, I really appreciate, again, everybody who's joined us today. Members of the community, remember that everybody who's here is working for you in some aspect. Reach out to us when you need help. The unemployment claims challenges, send emails to Commissioner Olson, Commissioner Starrett, and me, and we can reroute you to somebody at the employment department. Cases are rising. We had in Oregon today announced 7 more deaths, 7 more people who died of the coronavirus, and 380 new cases. And with the percentages of case to fatalities, that is more people that we are going to be mourning in the future. So as Mayor Kate pointed out, we don't know what's going to happen in September, but I know what we can do right now. We can wear a face covering, even though it's annoying and hot, but surgeons do it all the time. My father-in-law wore one every day of his career. And we can pay a little bit of kindness and patience with each other. That's one thing that I need to remember all the time. And so I say that aloud for my own benefit. But I know that a lot of people here are working out for you, and we're here for you. So until Friday, thank you, everybody, and we will see you then. And stay safe.